practitioner in the Toledo area. I work at an academic institution with a group of vascular surgeons, so venous leg ulcers are definitely one of my passions. I wanted to share some really great things with you guys today, especially while we're all kind of struggling with the COVID situation, to take our minds off that and share some great tactical, good practice pearls. One of the products that I've been using recently pretty heavily and that I really, really love is the Urgo K2 compression wrap. As we all know, compression is absolutely crucial when we are treating venous leg ulcers. One of the things that I've found about the Urgo K2 wrap is that it provides a really, really great source of compression while maintaining patient comfort and allowing our patients to kind of maintain their normal and active lifestyles. One of the unique things about this wrap is the efficiency that it helps the calf muscle work. So we know that short stretch wraps help our calf muscle, or our second heart, with the venous return, getting the blood back up to the heart. Because of the unique properties of the K2 wrap being short stretch and long stretch, we have seen a huge decrease in swelling in our patients that we are using the K2 wrap on. We're getting a lot of the benefit that we see with similar 4-layer wraps without all of the bulk, because of the fact that the Urgo K2 wrap has the short stretch wrap as the first layer and then the long stretch wrap. We've really maximized the ability for this wrap to work when the patient is active and moving and that calf muscle is needing that little bit of support, as well as when the patient is lying down or sleeping or watching their football game on Sunday afternoon. So we know that wounds don't sleep, right? The Urgo K2 wrap, because of that short stretch and long stretch component, allows that compression to remain continuous. So one of the things that's really cool about the K2 wrap that I haven't seen with some of the other wraps is the sizing, right? So with the K2 wrap, we are looking at 2 different sizes based on the ankle circumference of the patient. So being able to size the wrap allows us to get that continuous and consistent compression. The second thing that offers a really huge benefit is that with a lot of the compression wraps that we've used in the past, how tightly we compress or how adequately we compress can depend on tons of things. I always joke with my patients that when I'm doing compression wraps, if I don't have some sort of guide, my compression adequacy is based on my mood. If I'm having a bad day, I'm going to be more apt to wrap really, really tightly and harshly. Whereas if I'm having a good day and I'm talking to my teammates and we're kind of, going through things real leisurely, I might not wrap quite as tightly. The Urgo K2 wrap, because of the circle indicators on the wrap, gives you a visual representation that you are getting adequate but not too tight compression. So I feel that both the sizing and the fact that we can see just how tightly we're compressing adds a huge benefit. So that sizing, the fact that the Urgo K2 has a short stretch and a long stretch component, our circle indicators, and the fact that based on the size of the patient's ankle and the wrap itself, we know how long or how far to overlap. So if we're using the smaller wrap, we're going to overlap 50%. If we're using the bigger wrap, we're going to overlap 2/3. So again, all of these indicators and these unique factors about the Urgo K2 wrap allow us to ensure that we're getting consistent and adequate compression. One of the other benefits that I've seen of this wrap that I'm really excited about is that not only are we getting that adequate compression, but my patients absolutely love that they can throw their shoes on when they walk out the door. So a lot of times when we're using the 4-layer wraps or some of the more padded other 2-layer wraps, the patients have trouble wearing their regular shoes. So that's another benefit that we found. So again, as we're kind of going through things, I wanted to bring focus back to what we do and what we do well with our venous leg ulcers. I'm really excited to be using this product. I'd love to talk with you guys if you have any questions about it, and love to see you try it. It's really doing a great job out here.